Hi, I'm one of the directors at JIFJAF. We built the MyBotGP range. They are downloadable products that are powered by automation. And what this product does, and the reason we've been asked to make this short overview video, is to show you how MyBotGP is able to be configured at practice level in order to filter on normal and abnormal pathology tests. MyBotGP is also able to send text messages as well to patients to confirm a normal result. Some of our clients are filing over 75 different pathology tests plus COVID tests. And we even have some clients now telling us that they can push some radiology tests through MyBotGP. It's all about the rules and how those rules can be configured and what tests can be filtered on those rules. Will determine how many you can essentially have the tool filter for you, and that's what I'm going to quickly run through today. Here's a quick snapshot, indicative ranges, obviously, of what some of our clients are using MyBotGP to filter on. I think there's 55 on this, and as I touched on before, we have some clients on using over 75 different pathology tests, but I'll come back to what that means in a moment. We won a place on a health innovation government-funded and NHS-funded launchpad program. We don't have a tremendous amount of time on here, so I will skip this and get to the interesting part. Every doctor in the country is spending up to 19 days a year filing normal pathology tests. And when we say normal, we don't mean just the ones that come from the labs and need to confirm that they need no further investigation. MyBotGP is a downloadable tool whereby you have 5 rules to pick from, and then you can configure those rules whichever way you see fit in order to pick out the tests that you believe are normal and don't need further investigation. So you can configure these rules on any combination of the following decision points: minimum, maximum ranges, checking previous test results to look for percentage increases or decreases, keyword checks or absence of keyword checks on the pathology report. And for example, does it say diabetes on the problem page for HbA1c? Gender and age. So what MyBotGP enables you to do is to use any 1 or 2 or 3 or 4 or 5 of these rules in any combination on any pathology test, and that will allow you to find the ones which can be filtered on normal as against abnormal, don't need to be reviewed by a clinician, quite quickly. It's set up, runs in the background. It will log into your system, whether you're using EMIS or System 1. It will read all the pathology reports. It will look for the pathology reports that it's been given permission to filter on, to add the rules for. It will open them up, read them, and then make a decision based on what you told it to do. Am I agreeing with the lab? Or am I happy with it being in range? Or am I looking for a keyword or an absence of a keyword? Am I breaking off something in terms of age and keywords or age and previous test results? Configuration could be changed at any time, and you've got the ability to supersede laboratory ranges if you wish. Nothing's removed from the system. There's a full audit log of everything as well. So tests aren't whizzing through without you having any visibility of them. Not in the slightest. You can see absolutely everything that MyBotGP does. And it runs in the background and doing its own thing, looking for the pathology test that you've given it permission to review and applying the rules that you've given it. And this is how some of our clients have got up to 75 pathology tests. And as I said at the beginning of this quick tutorial, over and above COVID tests and some radiology checks as well. The average doctor in the UK spends up to 19 days a year filing normal pathology tests. So that's a lot of time can be saved to do more important stuff. Here's an example of the dashboard. So where we've got here, what you can see here are drop-down menus and tick boxes essentially, which we've configured so that you are able to choose which of those rules you want to apply. So let's say, for example, you wanted to file everything as normal that comes from the lab and is defined as normal from the lab. We tick that box, and then MyBotGP will just file it in the background for you. If you're not comfortable with those ranges, or you want to add additional checks, or there are no ranges and additional checks need to be done on pathology tests that are coming in, then you've got the ability to do that through here. So here you can say, you know, am I looking for keywords? Do I need to look for an absence of a keyword in the problem page? Does it say HbA1c in the problem page, for example? Does it say diabetes in the problem page for HbA1c, for example? And you tick the relevant box and write the keyword in here. Here you have your ranges, indicative ranges. These can be changed at any time, or you can choose the ones, agree with the ones that come from the lab. And MyBotGP will open it up, have a look, and if it's within range, it will pass it, and if it's out of range, it will fail it. If any one of these is out of range, it will fail it. You can also ask MyBotGP to do percentage calculations against previous test results. So, for example, for the top one, serum albumin, you could, and I'm not saying you would, but you could say to it, I'm happy for a 5% tolerance against the previous test result increase for this particular test. And all you'd need to do is to click yes and write 5% in here. So the way that, and then here, obviously, you can file with or without comments, and you can also send text messages to patients. So the way that it works is it will open up your system. It will look for the pathology test. It will open the pathology test, and it will say, what am I allowed to look for? Oh, I'm allowed to look for liver function tests. Great. What rules do I follow? I'm not worried about a keyword. These are the ranges. And for this one, by example, although we haven't configured it here, go back in the patient record and look for a previous test result. What that gets you to is this nice little list of pathology tests here. I'll open up this one here. Again, we can scroll through this, not at a tremendous pace, but slowly enough for you to have a quick look. And this is what your colleagues are doing across the country. Now, these are indicative ranges, and we're not saying that you would agree with those. You know, everyone's got a different opinion as to how they would filter on normals and abnormals. For example, prostate, lots of our clients like this logic here. 5 ages, 5 different ranges. Other clients don't like that logic. They want to do checks against previous test results. How it's configured and what rules you apply are completely up to you. What we do is we give you a tool that you can set up to do with as you wish. And you can see here, these are split off in terms of gender, some are split off in terms of age, others are looking for keywords, omissions of keywords, file with comments, file without comments, and so on and so forth. And again, this particular list finishes at 55 pathology tests, but as I said before, we have 7 clients with 75 plus tests, and that list is growing all the time. It's quick to download. We download MyBotGP onto a computer at the practice. We turn it on. It will run for a couple of days in the background. We don't need clinical time to do in the first install, and it will look at all of your pathology tests and it will save them all in its memory with all of the ranges that the labs have provided, and obviously it will also save the ones which haven't got lab ranges there. A couple of days later, it's been enough time to see a bundle of pathology tests. What we do is we book an appointment with whoever's going to sign the ranges off and make at practice level, whichever clinician is going to do that, and we spend about an hour and a half on the phone running through each pathology test. They're all in red, and we open them up, and are you happy with the ranges? If you are, click save, and MyBotGP knows what to do with that test. Next one, you know, are you happy with the range? No. For example, if you want to change the range, you can just change it, press save, and it knows what to do. Next pathology test, you know, am I looking for a keyword or an absence of a keyword? Or am I going back into the patient record to look for a percentage increase or decrease and a keyword, or an omission of a keyword? Or, there are no ranges associated with this pathology test. Do I just look for keywords or omissions of keywords? And within a short space of time, MyBotGP will be up and running. It can be scheduled to run any time, just works away in the background, and you can log in and change it at any moment. If the labs change ranges or keywords change, then that's not a challenge. You can simply log into the panel and make the necessary updates. It's super important for this that I can confirm there's a very comprehensive audit report off the back of it, as you would expect. And same for EMIS, same for TPP. Everything that MyBotGP touches is tracked and logged and anonymized. Every day you will be, in terms of filings by date, category, and a breakdown of what's actually been done by patient. So every day you'll be sent an audit report saying, this is what I've done, this is what I've looked at, this is what I filed, this is what I haven't filed. Within your system as well, depending which one you're using, you've got the ability to make the decision yourself, not us. You make the decision whether you want to do archiving straight off the bat, or whether you want to leave the tests to be reviewed to be reviewed by a person if they want to do that. So what happens is anything that MyBotGP has looked at, it's marked and tagged so you can clearly see it, to save time. Why do you want to do it? Well, the reason that you're listening to this, lots of work, overrun, and essentially this type of technology is now available for primary care. Up until now, you've been quite limited in terms of making best use of automation, and this product has been built to be quick to download and bespokeable at practice level. So MyBotGP, if it's acquired by PCN, which is our target market, each practice, if you're configuring pathology tests individually, i.e. you don't have a hub, you get your own copy. So differences of opinion or differences in different lab results, different ranges, different keywords aren't a challenge. We simply send each practice an email. MyBotGP is downloaded quite quickly and then configured and up and running in a couple of days. We provide lots of training and lots of support. As to who you send a text message for which pathology test, that's up to you. Again, we've seen lots of differences in approach between practices as to who they message, how they message, which test they message regarding, or which ones they don't want to message. So hopefully you find that useful. This is an overview of how these logic points, any combination of these logic points, can be used to pick out normal pathology tests. Minimum, maximum ranges, previous test results, keywords, absence of keywords, gender and age, and that results in something that looks a bit like this. Thank you very much.